Well, what if I have a herniated disc? Do I need surgery? No. Coming up next. When you have a herniated disc, that has happened over time. As I said in yesterday's video, we'll put that link in the description because yesterday's video is a really great lead-in to today's conversation about sciatica and herniated discs. Because a lot of people do have a herniated disc or a bulging or protruding disc that is pressing on the sciatic nerve and causing their pain. So you can fix it. It's actually not that difficult. You just have to build strength in certain areas and soften and release other areas. And that's why, again, it's so important for you to understand if you have one hip that's higher than the other. Typically, the herniated or bulging disc is bulging out to the low hip side. Typically, I would say like 9 times out of 10. The high hip side is more the cause of false sciatica and glute min trigger points. If you've been diagnosed with a herniated disc, I know it sounds scary. I know it's painful. I get it and I understand. So the first step in healing your herniated disc is breathe in your belly and see yourself healed. Breathe in your belly, soften those muscles that are gripping around the spine with belly breathing, and then see yourself well, setting that blueprint into your nervous system, remembering what it feels like to move with ease, remembering what it feels like to do the things you love with joy and happiness and without worry and pain. Because that, as we said, we talked about proprioception in this series. We talked about how that's a blueprint, that's muscle memory. And if you keep seeing yourself unwell, in pain, hurting forever, getting stuck in worry, you're going to keep sending those messages into your nervous system, and it's going to keep you stuck in sciatica. So the first step is breathing. Step 1.2 is seeing yourself well and healthy and moving freely and easily. Now, the second step is understanding which hip is higher. Understanding which hip is higher is going to set you up for the practices that you need to do to heal your sciatica symptoms. If your right hip is high, there are 3 key areas that you need to release. You need to release the right inner thighs, the adductors. You need to release the left outer hip, and you need to release the right side of your low back. Because when the pelvis is sitting high on the right side inner thighs get short, the left outer hip is collapsed down, that is short, and with that right hip high, the quadratus lumborum muscle in the right side is short. If you are stretching and stretching, trying to stretch that disc back into place, you might be stretching the wrong side. So you want to open the high hip side and lift the low hip side. And to really be able to level and balance the pelvis, you need to really release those right inner thighs. We'll put a link in the description to some videos on how to do that. And we're continuing to teach you these practices through this month. You need to release the left outer hip first, and then you need to release the right side low back. Those muscles that are short, as you lengthen them, that pelvis will start to drop on that high hip side and start leveling your pelvis. Now tomorrow I'm going to teach you a very specific practice that was created by a man in New York City who is a doctor as well as a yogi. And he was like working with people with scoliosis, and sciatica and a herniated disc is effectively functional scoliosis that you accidentally gave yourself without being mindful of your posture over many years. And so tomorrow you're going to learn an excellent practice for that strengthening. In the meantime, start using the soft ball from our free body toolkit. Start using the ball and that larger ball. Do that adductor magnus release on the chair. We'll put that link in the description. Releasing those inner thighs, doing the wide angle side to side movement break to start hydrating those tissues, doing some release of that left outer hip and some release in the right low back to start easing the pull of those muscles. It's helpful to understand which muscles are short and which muscles are long. So one more time, when the right hip is high, the right quadratus lumborum in the low back is short, the left outer hip muscles, glute min, glute med, TFL, they're short. The right inner thigh muscles are short, pulling that pelvis to the side. If the left hip is high, you want to release the left inner thigh, the right outer hip, and the left low back so that those muscles can soften that pull and level the pelvis. This is crucial understanding that I've never seen anybody else really talk about. I put this sequence together when I was fixing my own sciatica because I kept going to the place where it felt like the pain was coming from. I even looked it up in my trigger point books. I would get on that point, my glute min, everything would get better for a little short bit, and then it would just go right back. So what I had to do is take a step back and go, what is this whole system? And really what I was doing was releasing the muscles that were long. And that's why I couldn't really get better. And once I started releasing the opposite side, the right inner thigh, because my right hip wants to be high, the left outer hip, and the right low back, then I was able to get out of sciatica very quickly. I was able to heal my herniated disc very quickly, and I never had the pain again. Never once in 15 years have I had it again. So do those movement breaks, pay attention to your posture, get excited for tomorrow. I'm going to teach you a super quick strengthening practice that's really going to help level your pelvis and make a world of difference in your experience with your sciatica. See you next time.